Have you ever lost your voice or had a sore throat and wondered what might be the cause? Well, one possible explanation could be laryngitis. This is a condition that involves inflammation of the voice box, or larynx, which can result in voice changes such as hoarseness or even loss of voice. Laryngitis can be either acute, meaning it comes on quickly and lasts for no more than 2 weeks, or chronic, which means it persists for more than 3 weeks. It's worth noting that laryngitis is a common condition. At some point in our lives, many of us will have experienced the discomfort of a hoarse voice or a sore throat that laryngitis can bring. So now that we understand what laryngitis is, you might be wondering what causes this uncomfortable condition. So what triggers this inflammation of the voice box? Well, laryngitis can be caused by several factors. One of the most common culprits is viral infections, much like the ones that give us the common cold or the flu. But there's more to it. Have you ever had a day where you've talked or shouted more than usual? Maybe at a concert or during a passionate debate? Well, straining your voice can lead to laryngitis too. It's similar to how overusing a muscle can cause it to become sore and inflamed. And let's not forget about irritants. Smoke, including secondhand smoke, and allergens like dust or pollen, can also inflame the larynx, leading to laryngitis. Even regular exposure to chemical fumes or excessive alcohol can be contributing factors. Understanding these causes is crucial, as it can help us in preventing laryngitis. So remember, take care of your voice and be mindful of your environment. Knowing the cause is half the battle, but how do we identify laryngitis? What are its symptoms? If you're feeling a tickle in your throat, it might be more than just a common cold. In fact, it might be laryngitis. Laryngitis is an inflammation of your voice box, or larynx, from overuse, irritation, or infection. It's not uncommon to experience a hoarse voice or difficulty speaking. You might find yourself frequently clearing your throat, dealing with a dry cough, or even battling a persistent sore throat. Now let's talk about diagnosis. When you visit your healthcare professional, they'll likely start with a physical examination. They'll check your throat for redness and swelling and listen to your voice. In some cases, additional tests might be necessary. A laryngoscopy allows your doctor to get a closer look at your vocal cords, and if infections are suspected, they might take a throat culture to identify the culprit. Now that we know how to identify laryngitis, let's discuss how to treat it. Got a case of laryngitis? Don't worry, there are ways to soothe your sore throat. Now let's talk about pharmaceutical treatments. If a bacterial infection is causing your laryngitis, your doctor might prescribe antibiotics. But remember, antibiotics won't help if a virus is the culprit. In some cases, corticosteroids may be used to reduce inflammation and swelling, but pharmaceutical treatments are not the only option. There are also homeopathic treatments that can help. Resting your voice is one of the most effective remedies. Hydration is also key, so keep that water bottle close. Steer clear of irritants as much as possible. This includes smoking and alcohol. For chronic laryngitis, more serious interventions might be necessary. This could include voice therapy or even surgery, but don't let this alarm you. Chronic laryngitis is less common and usually occurs due to prolonged exposure to irritants or misuse of the voice. Remember, if your symptoms persist, it's important to consult a healthcare professional. Take care of your voice. It's the only one you have.